So, COVID cases across the country have fallen to their lowest point in months. The focus now will be keeping these numbers low. To do that, we know that infection control and the effective suppression of any new outbreaks is key. And in regional areas, access to appropriate medical resources is paramount. Throughout the pandemic, the Royal Flying Doctors have been on the front line treating and transporting COVID-positive patients across the country. They've helped more than 1,900 people who were suspected or confirmed to have had the disease. The Drum's Stephanie Bolchi has more.
You strap on your boots and you go.
Ali has been transporting COVID-positive patients in Melbourne.
You see everything from super sick patients to people who are asymptomatic and aren't showing anything, and you wonder, oh my gosh, how do they have it?
The majority of the Royal Flying Doctors' COVID transfers from across the country happen not in the skies but via road in Victoria.
As far as decontaminating goes, the truck, it takes about 30 minutes. Now we've got it down to an art.
As is getting their PPE on and off.
It's your little safety blanket. It's amazing how things have changed from when we didn't even wear masks, for every patient.
3 Victorian RFDS staff members have tested positive to COVID-19, but they say they haven't been confirmed as contracting it on the job.
I know some people who have moved their bedrooms into the garage and using that one outside entrance exit to get in and out.
Emergency flights into regional and remote areas have continued too, but with precautions.
The additional protocols might add 2 or 3 hours to a flight typically. We didn't want to take disease into those communities.
But concerns remain. Now borders are starting to reopen.
We're sort of on standby really to move into those communities very quickly, to take respiratory testing into those communities, possibly to evacuate their contacts as well.
Respiratory clinics have been set up across New South Wales and Victoria, including here in the Broken Hill base, as well as pop-up ones in remote communities such as Wilcannia, Menindee and Ivanhoe.
They'll drive out or they'll fly out in designated cars and designated teams. We bring all our results, our testing swabs back to Broken Hill to be forwarded on to our local labs.
But as cases continue to drop, the traditional roles of the Royal Flying Doctors will be vital.
We think part of the next wave of the COVID response is going to be ensuring that people who might not have had as good access to primary health care in recent months get that access, and that we deal with the sort of backlog of demand that will have been built up over the life of the crisis.